All right, so let's get started. So I'm Josh Rosenthal. Thanks for joining us. This is our final webinar for the week, concluding our series. We talked about ADHD on Tuesday. We talked about ODD yesterday, and today we're talking about anxiety. Wonderful way of ending the week. Thank you to all of you who have come out to all three webinars. You've probably seen a lot of overlap, and that's because there is overlap. You know, working with kids and families, there's a lot of things that are the same, which makes it good to be a clinical psychologist working with kids. So today, we're going to talk about anxiety. There's a lot of anxiety to go around. And so I think this is a really good webinar. I appreciate you coming out, and I hope that you learned something else today as well. So we're going to talk about some psychoed. We start every CBT program with psychoeducation. I'm going to talk about assessment and diagnosis. Again, parent management training. You're probably so tired of hearing me say that word. Parent management training, individual CBT, which is very good for kids with anxiety versus ADHD and ODD. It's not as helpful. Some main takeaways, resources, and then Q&A. The Q&As have been amazing. Every webinar, we get 50 plus questions, and I wish I had time to go through all of them. So I really appreciate the questions. I appreciate the interaction, the dialogue, and trying to make this webinar as fun as possible. You could be doing anything with your hour today, and I appreciate you joining us. So keep your eye out on the chat box. We're going to put some links in there. We're going to do some polls. We're going to put some resources in. Please use the Q&A feature for questions instead of the chat. I'm going to go through the Q&A at the end and cherry pick some questions I think will apply to the most people. Tomorrow we're going to send out a feedback survey with some questions. Please complete that. It helps us do a better job. And then also a video recording link to all three webinars. And please make sure to, check your spam folder. It will be coming from Zoom. We are not providing CEUs right now. We'll be working on that. Hopefully the next time we'll have our certification for that, but you can use your registration as proof of attendance. So I apologize if you attended the other ones. I'm a licensed psychologist. I'm licensed in 3 states since 2008. I'm also the owner and the CEO of Manhattan Psychology Group. I specialize in working with kids and families, and ADHD, ODD, anxiety are all things that I talk about a lot. I used to run a summer treatment camp in Manhattan called Big Apple Day Program, and I started an online progress monitoring tool called the Electronic Daily Report Card, and I supervise students at some local programs. Our company, Manhattan Psychology Group, is a little different. We're multidisciplinary, so we have a team of over 100 people, including psychologists like me, neuropsychologists, BCBAs, board certified behavior analysts. Those are people that specialize in working with kids with autism as well as other childhood issues, and special educators, so special ed teachers who may or may not have ABA training. We specialize in evidence-based psychological, behavioral, and educational services. We provide testing services as well as treatments, and we work with birth to boomers, so all ages. We even do couples therapy. And all of these different disorders. We see tons and tons of kids, hundreds of kids every week. And we're in the office, school, and obviously remotely with telehealth. We have an office in the Upper West Side, but we do work with families across the country, both clinically and educationally. And I'm a huge proponent of Carol Dweck and the growth mindset. And I try to use it in growing our company and how we work with families and how we work as a team to accomplish our goals. I'm going to showcase Dr. Rosen today, Chelsea Rosen. She's an expert in anxiety as well as other childhood disorders, but she is the one who's going to be running our educational 3-part webinar series, as well as our clinical parent training group, both of which are starting in a couple of weeks, and we're going to post some links to those very shortly. Excuse me. If I play my cards right, then my mission is to improve the trajectory for individuals and families. Like, that's the main thing that I'm really focused on, is how do we find the families, how to create awareness, how do we work with them as soon as possible, as early as possible, so we can create the biggest impact on that child's life. And that's really sort of my mission, and the company mission is to try to change the trajectory for these kids that are struggling and their families. And if we do our mission, we will accomplish our vision, which is to create confident, independent, productive, connected, kids and families that have meaningful relationships with each other. This is the why we do our work. This is what gets us out of bed every morning. And this is sort of the purpose behind it all. So we talked about, special strings or narratives for all these different childhood issues. And so for today with anxiety, I want you to think about anxiety like a broken alarm system. So kids with anxiety disorders and adults, their alarm system that's telling them that something is not good and they should be afraid is basically broken. And we need to fix it using treatment and sometimes medicine. So we're going to work on changing their alarm system. So anxiety surpassed depression a couple of years ago as the most popular and common disorder in America, 40 million people. And we've seen it double basically during COVID. Not surprising, right? So anxiety is very heavily influenced by the environment. There is a heritable factor, which I'm going to talk about, but very much related to what's going on around you. So not surprising. I live in New York City. If you live in any major city, a lot of anxiety, not just about COVID, pressures, got it, lots to do. And so there's already anxiety, not necessarily a bad thing, which we're going to talk about, but with COVID, it's just skyrocketing. So lots of work to do, lots and lots of work to do. And if I haven't talked about this before, there's basically a shortage of therapists and an over demand. Doubling, think about this, we're doubling the need for anxiety treatment, but we're not doubling the therapy or the mental health providers in a year, 2 years. So there's a huge need. And part of the reason why I'm doing these webinars is to try to solve that problem, is how do I create more awareness so we can reach more families using telehealth, which has basically been, the silver lining of COVID is this explosion in telehealth medicine and telehealth in behavioral health services. So that's why I'm so passionate about doing these webinars right now. So anxiety is pretty common and there's lots of different types. We're going to do a quick poll right here. Do you know anyone who's being diagnosed with OCD, which is one type of anxiety disorder? I love watching these numbers go up, seeing so many people vote at once. It's so powerful. All right. So I think it's pretty clear. We can share the results. 71% said yes, 24% said no. So that's a good chunk. OCD is not the most common anxiety disorder, but it is out there. And hopefully you'll learn about the treatment of OCD today. So thanks for completing the poll. So you can see there's lots of different types here: generalized anxiety, social anxiety, separation, and I'll go through what these are a little bit. But usually when you have anxiety, when the child has anxiety, they're going to have multiple types. So they might have generalized anxiety, and then all these other types will pop up. So the numbers may seem small, but when you add them up together, it can sort of be really debilitating for a child with clinical anxiety, and for the family, right? Because the family is the one trying to deal with it. So how does anxiety develop? How does it begin? So if you ask any provider, what is your favorite childhood disorder to treat, they're always going to say anxiety. And that's because we have such good research and such good treatments available for kids with anxiety. Like if you ask 100 psychologists, what do you treat? They're all going to say anxiety. No one says, no, I don't work with kids with anxiety. So what do we know? We know that most kids who have anxiety, clinical anxiety, they have what's called an inhibited temperament. And that means that as young children, they have this tendency to withdraw or avoid or respond fearfully. And that creates a 7 times multiple risk factor as they get older. So you, as a parent, you're looking out for that. And if you're an anxious parent or you have clinical anxiety, you're looking out for that in your child. We also know that, if you have anxiety as a parent, your child is twice as likely to have it. We know that environmentally, parental over-involvement or like helicopter parenting can increase anxiety in children. They're basically saving their kids from experiencing discomfort so that they're very fearful of discomfort as a result. And again, it's not a parent trying to create anxiety, they're trying to do the best they can, but they inadvertently do that. Kids with anxiety tend to be overly self-focused. So they're very, very worried about themselves and the focus of themselves rather than the focus on other people. And so, if you take a kid who has social anxiety, if you ask them, are you, you're worried if everyone's going to like you, but are you worried if you're going to like them, right? So they're overly worried about themselves when maybe they don't need to be. There's also a lot of intolerance with uncertainty and worry. So, that's why anxious kids are always asking, what are we doing next? What's happening next? What's the schedule for the day? And they ask like a lot of repetitive questions. So they just have trouble with managing that, not knowing. And then as in most childhood issues, it's a combination of nature and nurture. So you have this child with this temperament, and then you have a parent maybe who has anxiety as well, or they're not sure how to respond. And then that sort of makes it worse. And then kids, developing, as they get older. So it's a confluence of different things. As is always the case, we're complicated beings. So what do we know about childhood anxiety? We know that it's expected. We know that it's typical. Kids are afraid to be alone in the dark. They're afraid of monsters. They're afraid of separating. All these things are totally normal. And so it's the rule, not the exception. And so we can normalize it, right? We can say like, I understand that you're, afraid of sleeping alone in your bedroom. I was afraid when I was your age. And I learned how to handle it and outgrow it. We also know that it's short-lived, right? These things, kids go through normal stages, and it's it happens for a minute and then it goes away. If you handle it well. Now you can mishandle it and make it worse, but if it's handled well, it'll go away. And we also know that coping with or facing anxiety is a typical developmental task and an opportunity for mastery. Like, I love the idea of how do we build self-confidence in anything, right? We have to do something that is a little bit challenging, we overcome it, and that's what makes us feel good about ourselves. So it's an opportunity to what we're going to talk about being brave. So that's sort of the way that you go against anxiety, is by being brave. We're going to talk more about that later. And anxiety is a good thing. We have to be anxious, right? Like, there are things that can hurt us in the world. You don't want to get burned, don't want to get stung, you don't want to get hit by a car. And also there's the idea of peak performance of anxiety. So right now, I would say, I'm above average level baseline for my anxiety level. I want to speak well. I want to, look like I know what I'm talking about. And so my anxiety levels are a little bit higher, and that's helping me perform better. I like to use a scale of, 0 to 10. 0 is you're basically dead. You have no heartbeat at all. 1 and 2 is very, very low. 3 is like normal anxiety, like you're just walking around, making sure that you're safe. 4 to 6 is sort of tolerable, but higher, and that's where I am right now. And then 7 and above is bad. That's when you have panic attacks and breakdowns and lots of interference and avoidance. So when should we worry about anxiety? The features and qualities you're looking out for as a clinician, as a parent, as a teacher are, when things are basically unrealistic or disproportionate to what's happening. So the child is like overly self-conscious to the point where they don't want to do something, and they're starting to avoid or escape. And they can't control it. They have these really scary thoughts and they can't control it. And it doesn't go away, right? So, and it's starting to impact on a daily basis. So we're going to ask another poll out here about anxiety signs and symptoms. Which of these symptoms do you see the most among kids with anxiety? Ooh, this is really interesting. '20. Okay. All right, great. So let's look at this for a second. So the most was excessive reassurance seeking. That's really, really powerful because that's something that happens a lot. Parents tend to do that because it works very quickly. I'm afraid that we're going to be late for school. You're not going to be late for school, I promise. You promise? I promise. Anxiety goes down, parent feels like they're a hero, child feels better for a minute. What happens the next day? I'm afraid we're going to be late for school, right? You're not actually addressing it. So the reassurance seeking works for a short amount of time. So that's very common, not surprising. 19% said they see tantrums, oppositional behavior, and aggression. And I'm glad people did that because a lot of people think that a kid is just being oppositional to be difficult or they have a behavioral problem, when really they could be anxious about something and they're acting out because of the anxiety. Somatic is the most obvious one that, parents are very in tune with. I have a stomach ache, I can't go to school. Well, you're not really sick, so you need to go. Difficulty being alone, avoidance. But good, I'm glad that most people are seeing the obsessions and excessive perfectionism. Again, OCD is more on the rare side, so that's not surprising to me. Thank you, though, for participating in that. Do I want to say anything else? No, I think that pretty much covers it. These are all pretty typical and just good things to be keeping your eye out for. So what are all these different types of anxieties look like? So separation anxiety is like the kid who can't separate from his parents, but it goes above and beyond, right? So when kids go to school for the first time or nursery school or drop-offs, there's always a transition period. These kids cannot transition. They simply cannot. Every drop-off becomes really difficult. There's no progress being made. And oftentimes there's a parent component here too. Selective mutism, Dr. Rosen happens to be an expert in selective mutism. So very difficult to treat if you don't know what you're doing, but if you do know what you're doing, it can be a game changer. I mean, I've seen kids go from no talking to talking in one session, very behaviorally oriented. Social anxiety, very common with teenagers, but again, very easy to treat, a lot of good group treatments for social anxiety. Generalized anxiety is what you see the most of, these sort of like little, old people walking around worried about everything, fearful of everything, kind of rigid, a little bit difficult to have fun with sometimes, unless they're in their element. But very common, you see those kids in treatment. OCD, again, very effectively treated what's called exposure response prevention, which is a type of a CBT, which we're going to talk about. And then specific phobias, kids are afraid of bees and dogs and stuff like that. Again, very easy to treat if you know what you're doing. So this cycle right here is really important to know, and this would be part of the psychoeducation piece. So let's start at the top. So child is prompted to do X. So let's say we wanted the child to get dressed in their room, right? So you go in, you wake them up. Hey, good morning, Josh, time to get up. I'm gonna go make breakfast. Please put your clothes on. Now the child is anxious to be alone in their room for whatever reason. They just have that type of anxiety, right? So what do? They avoid getting dressed. They come out of their room. They start screaming or yelling, anything to get the parent to come back in. Now they could be anxious that it's hard to get dressed. They could be anxious about being alone. They could be anxious about who knows, right? Lots of different things. But the idea is that they're anxious. They're not communicating. The parent doesn't have a plan about this. They start to avoid. Now, as they start to avoid or act out or tantrum or whatever, the adult decides to go in and rescue. So the adult comes in and says, oh, that's okay. Like, I'll help you get dressed. They come into the room. They start putting the clothes on. The child's anxiety goes down because they're not alone. They don't have to put the clothes on by themselves. The adult's anxiety goes down, right? Because they see their child being anxious. It's making them anxious. And the whole process is negatively reinforced. So this happens over and over and over again anytime a child is struggling with anxiety. And part of the intake process is to figure out these patterns so that you can correct them. So how do we assess for anxiety? So again, lots of good tools to use. You can do an unstructured interview or a structured interview with the ADIS. Again, it's going to come down to having a really good detective as your psychologist or psychiatrist or mental health professional, whoever is doing the intake. You're looking at what are the anxiety symptoms, how severe are these, and how are they interfering? A child who has anxiety may not have any interference. It may just be something that makes the morning a little slow, right? So it's a little slow, it's a little frustrating, but they get to school, there's really no issues, and it's getting better with time. So I wouldn't say they need treatment. I like to always ask about the parents, how they're doing whenever we're doing any sort of child treatment. So how strong is the parental alliance? How stressed are the parents? And then how happy are the parents in their marriage if there's a partner involved? And the reason for this is because you're going to be doing parent training with them. And if their relationship is terrible, or this parent is really going through a lot of personal stuff, you need to know about it, because they're going to have a hard time communicating and solving problems. So I love to ask about that. And I think it is always part of the conversation. If you're dealing with kids, you should always be including the parents, because they're going to be, coaches. Basically, you're training them to be coaches. With anxiety, you want to make sure kids are getting good sleep and they're exercising. Exercise is a wonderful natural treatment for anxiety, as is, natural treatment for depression. I mean, overall, it's just really good. And then making sure that the kids are eating in a way that's their blood sugar is not fluctuating too much, because that could affect how they feel. And then there's a lot of good, free questionnaires that you can use. And I listed a couple there to measure anxiety. So you could take one at the beginning, and then maybe 3 months in, and maybe 6 months in. Now, neuropsych testing or psychoed testing is not necessary for an anxiety diagnosis. It's pretty common in New York City and probably some other major cities. Parents like to have sort of a full picture. They want to make sure that there's nothing else going on. There's a lot of overlap and differential diagnosing with ADHD, and even kids that are on the spectrum will, present as having anxiety, and they can definitely have both. But sometimes the testing can help figure out, or there's a learning disability going on. And so that's why you might get testing. But again, you don't need the testing in order to get a diagnosis of anxiety. So what are the evidence-based treatments? Well, it's pretty clear. We've got tons and tons of research studies, and everyone who does a research study on anxiety, you always come back with some pretty robust findings if you're using medicine or CBT. And we find that, for kids that have, moderate to severe anxiety, CBT and medication is really the way to go. And it lasts, right? So, you learn these really powerful skills, and you can see some big improvements. So we're going to talk about CBT, and I'm going to talk about medicine a little bit, but mostly CBT. So in CBT, and I think in any real therapy, right, is you want to make sure you have a strong alliance, right? So what is your rapport with the parents, with the child? Because you're going to be taking them on a journey, right? And you need them to trust you. You're going to be doing a lot of things together, and they have to trust you, especially if you're doing exposures. So you want to make sure that, the alliance is strong, they feel fully understood. That's why the intake is so important, because that's the beginning of that process. And then you're going to move into psychoeducation, where you teach them about that behavioral cycle of avoidance. And you really flush out all the different ways that there might be accommodation, which we're going to talk about. And then after that, you're going to start teaching skills. And so the skills you're teaching are about, becoming more aware of your thoughts and feelings and your behaviors, creating a fear hierarchy, setting up some goals of which fears do you want to accomplish first. You always start easy and work your way up. And then figuring out how you can start to challenge your thoughts. Like kids that have, anxiety or these broken alarm systems, they're getting these really, really powerful thoughts that are telling them that bad things are going to happen. Not just OCD thoughts, but just it could be general anxiety thoughts, like I'm going to be late. And if I'm late, everyone's going to laugh at me. And if everyone laughs at me, then I'm going to look stupid. And if I look stupid, I'm going to lose all my friends. They may have these really, really powerful thoughts. And so you can you can teach them how to challenge their thoughts. Now, if they have really severe physiological anxiety, meaning their body is activated from the anxiety, their heart is pounding, then they may need medicine to really benefit from the therapy. But nonetheless, challenging your thoughts, cognitive restructuring is a big piece of the cognitive in cognitive behavioral therapy. At some point, you're going to move into what's called exposures, and the treatment is ERP, exposure response prevention. And that's basically where you take an anxiety, right? So let's say it's being late, right? The child is really, really afraid of being late. And you would gradually expose them to being late. And what are the consequences? What are your thoughts that are not true? Behaviorally, what's happening that's not true? And they just get better and better at tolerating the anxiety of being late. And you can do all kinds of really creative exposures that are fun, and you can use rewards to reinforce kids for practicing the exposures, but you're not going to see any real treatment or change unless you're doing exposures. So here's our poll on exposures. Thank you, Beth, for putting that in there. I forgot we have Beth and Samantha helping us out today with the links and the polls and the slides. So how many people have participated in exposure for anxiety treatment? Oh, wow, this is awesome. So most people have not, so that's perfect. You're in the right spot. Awesome, so let's share the results. So 66% of people have said no, and 30% have said yes. All right, so exposures, exposures are the way to go for anxiety treatment. The idea is that you're really not going to see any change in the level of anxiety unless you're being exposed to the thing that's making you anxious. And at the same time you're doing the exposures, you're also looking at like what things are maintaining this anxiety. So is the parent enabling the child to be anxious by saving them? How is the child avoiding the feared stimuli? And so that's part of the treatment, is like breaking that down and trying to problem solve it. You can also teach relaxation training. A lot of kids with anxiety have difficulty with social skills and solving problems because they get so anxious. So you're definitely going to be part of that. Now, any CBT treatment is not CBT treatment unless there is a home practice to it. So you should be going home and practicing, and I'm going to show you what a session looks like in a little bit. And there should be a parent training portion, right? Even preteens are going to need help with their anxiety work. They're simply not going to do it on their own. Teenagers may or may not want their parents to be involved, but certainly young kids and preteens, you're going to be involved as a parent. You can do, CBT treatment for anxiety individually. You can do it in a group. It's definitely good remote-wise. I would say kids 7 to 12, 7 to 11 really need to be in the office. Those are not really good Zoom therapy candidates. And you're looking for a 3-month commitment, once a week, 45 to 60 minutes. Now you can speed it up. You can add, parent training and CBT, individual CBT at the same time. It's just more time, more cost, but you can definitely do that. But it's an investment, right? Like parents say, how long is this going to take? And I say, usually a minimum of 3 months. You should see changes by then. You should have a full understanding of what's happening by then. And then, like I said, you're always making sure that exercise and sleep are good, and healthy eating as much as you can, but try not to battle about the food. That would be the last thing I'd be concerned about. Much more likely to focus on exercise and sleep. So what does parent training look like with anxiety? So like I said before, parents become the anxiety coaches, and their job is to teach and model being brave. So how does a parent teach being brave? Well, first of all, they want to make sure that they are showing being brave at all times. So if the parent has anxiety, so if a kid has anxiety, most likely the parent's going to have anxiety. And so you want the parent to be doing their best to show that they're working on their anxiety by being brave. So it could be, let's use being late. So let's say the child is afraid of being late and the parent is afraid of being late. Now, I know this for a fact because I definitely gave this to my daughter, who's afraid of being late, and I hate being late. So it's really funny to see her worried about it. And so I have to make sure that I am being brave against the fear of being late and all the irrational thoughts that I might have about that, as a model for her, right? Like, how can I expect her to be brave if I'm worried about it, right? So that's what it means by teaching and modeling. And teaching comes from using the principles that you're learning in the parent training, and then teaching those and reminding your child about them or practicing the exercises. We want parents to praise approach versus avoidant behavior. So approach behavior is anytime you see your child trying to do the skill or trying to be brave. So for example, if my daughter says, it's okay if we're late, nothing bad's gonna happen, or it's okay if we're late, I'm still gonna, learn the stuff I need to learn. Then I'd say, oh, great job, thinking about, great job being calm as we get ready to go to school, or great job being brave against, your worries about being late, something like that. And that is a way of praising the approach. So, or also if a child is afraid of being alone in the room and they try to go into the room, you would praise them for going into the room. Great job staying in your room, versus if they come out and you go, come on, I told you to stay in your room. That's giving attention to avoidant behavior. There's an expectation that everyone will try and see. So you could say as a family that our family tries and sees. So the easiest example is food, right? So I don't like that. I don't want to try it. Well, just take a bite and see what happens. See if it's terrible. You don't have to eat it. Maybe you'll like it. And this idea of try and see is like a muscle. And the more they try and see, the more brave they get at actually fighting against and being brave against anxiety. We talked about talking and reassuring earlier, and I talked about how common it is. And we really coach parents to try to stay away from talking and reassuring, because it doesn't really work that well. And when it does work, it's very short acting. It doesn't change anything. Now, at the same time, a parent might say, well, I know that they're going to grow out of this anxiety, so I don't mind reassuring them. I don't need to go through all the effort of doing exposures and getting CBT treatment. They're going to grow out. And that's very true. And so then I would say, well, if they don't grow out of it and it doesn't go away, then maybe change gears a little bit and try something else besides reassurance. I think I mentioned this before, that change will not happen without exposures. Start small incremental, systematic steps towards bravery. There's no rush here. We're not flooding anyone or trying to, overexpose anyone, because if you do, then they'll skip out, they'll drop out, and they'll just be like sort of traumatized by the experience, which we don't want to happen. A big thing is accommodating versus enabling. And these is like sort of a spectrum, right? So an enabling would be if a child is having trouble putting their shoes on, let's say, and they start getting anxious and refusing to do it, the parent comes over and just does it for them. Oh, I got this, right? And so they don't really give them a chance to do it. Accommodating would be if they put the top part of the foot in, but then the child had to step down and completely put their foot in. Or if they started with the shoe tying and then the child had to finish, right? So you're sort of giving them a scaffolding, exposing them to doing some of it, and being anxious a little bit, and not completely saving them. And like I said before, it's totally fine to use rewards to tolerate exposures and practice. Kids don't really get, addicted to rewards. They get addicted to the mastery and the great feeling that they have of being brave. So this is what a sample session might look with. And so the profile of the patient here is a 10-year-old boy. Is a 10-year-old boy who has perfectionism, fear of making mistakes, thinking he's stupid in math. I'm sure a lot of us can relate to that. He's very avoidant, and his parent is also anxious. So maybe his parent has a aversion to math too. So you always begin the session with a review, right? So let's say I'd said, okay, we're afraid of math. I want to slowly expose you to it. So for the next week, all I want you to do is just talk about math. Talk about math problems. Just talk about math for 5 minutes at a time. That's all you have to do. So they come in, we sit down and say, tell me, take out your practice log. Tell me about, how you practice. Oh, it looks like you practiced 5 times in the last 7 days. That's great. Tell me about how that went. And so that practicing and talking is like a little slight exposure. So then I say, okay, today our new skill is doing a number of math problems wrong. So the fear is getting them wrong. So we're actually going to do that. So we'd sit down and I showed him how to do the math problem wrong. I go through some of the fear thoughts that he might have. We come up with some challenge thoughts, and then he does the actual exposures. And I'm monitoring his anxiety level on a 0 to 10 scale to make sure that it's not too high, because I don't want that to happen. And I'm also not letting him escape or avoid. So it's a fine balancing between exposing and raising that number a little bit so if you're uncomfortable, so they can build tolerance, but not too high so they want to jump ship. And that's where good practitioners and really creative psychologists and mental health professionals come in here. Someone who's done it with lots and lots of kids. So after we practice the new exposure, then I'm going to assign a home practice piece with a tracking sheet. Again, it's not CBT if you're not doing something at home. And then I might review the session with the parent if the parent is not in the room. So let's say this boy didn't, want his parent in the room. I'd say, hey, I want to tell your parent what we're working on. As long as the boy is okay with it, I'd bring the parent in. Maybe I have the boy explain it to the parents. So the boy feels like he's building mastery. They love that. And then they go home and practice, or I meet with the parents separately. And there are treatments you can do if the child does not want to participate and it's just parent only. But again, part of being a skilled mental professional is being able to come up with a treatment that matches each individual family, rather than some sort of cookie cutter approach. So these are some other behaviorally based interventions. This one called space training is very popular, and it's parent only. So, in this, this age of COVID, this time of COVID, where there's tons of anxiety, lots of virtual work, and kids are, pretty spent on being on screens. This has been very popular and it's grown a lot recently. So it's parent only. The child does not have to participate, works with all ages, and it teaches the parents how to respond more supportively. And by supportive, it means in a way that doesn't undermine the child being brave. So we talked about accommodating, and also reduces accommodations of the child's anxiety. So in the beginning of the treatment, you go through like an inventory of all the different anxieties and then all the different ways that the parent might inadvertently accommodate the child's anxiety. And so the idea is, rather than participating directly in exposures, you remove the accommodations, which creates like these exposures and higher levels of anxiety. And that's how the child is able to overcome their anxiety. And it's really good for young kids who are not able to participate, or older kids who refuse to participate. And I'm going to share a book with you about that in a couple minutes. The other one that's really good is based off of the PCIT model. And so we have this live coaching behind a one-way mirror. You can also do it virtually, where parents get live coaching and helping their child overcome anxiety. It's really good for kids with selective mutism or other like very extreme amounts of anxiety. So you go through these exposure exercises by coaching the parent, and it's really good for younger kids when PMT alone is not working. And again, you can do it behind the one-way mirror, or you can do it remotely. Let's see. So the main takeaways for today are that anxiety is highly genetic and very much influenced by the environment. That's why we're seeing double rates of anxiety now because of COVID. It can be detected very early. We know that if a parent has anxiety, the child's more likely to have it. We know what are some things to look for in young kids, the behavioral inhibition, but it can be managed very well by properly trained professionals. CBT is the way to go, and I always say start out with CBT, and you're going to be challenging thinking and doing some gradual exposures and even some relaxation training. And then part of CBT is going to be working with the parents on reinforcing these exposures and then reducing accommodations. And again, this doesn't take a very long time because anxiety is very straightforward if you know what to look for. So you can see results pretty quickly. And then if the anxiety is severe or not, you're not benefiting, or the severity of anxiety is really interfering with the treatment, like you cannot participate, or your number shoots up too high as soon as you start talking, then medication is a good option, and it's very, very effective. And usually it's like taking an SSRI, not so much benzos like Ativan or Xanax. Those tend to be habit forming. So an SSRI like Prozac or Lexapro or Zoloft is very effective for treating the anxiety. So some resources. So if you want to find someone to work with, every state has a psychological association, which you can, they have referral services there. The Psychology Today directory is pretty good as well. You can also ask your pediatrician or your school. Or if you want to use your insurance, you can go to your insurance directory and then you can cross-check those names with maybe from someone else, like a school or a pediatrician. And then there's a therapist on the Anxiety and Depression Association website there that you can check out too. From us, like I said, Dr. Rosen's going to be giving a expanded version of this talk over the course of 3 hours, 3 weeks, 3 hours nationally, so you can participate in that. And we're going to put some links for that. Sign up. That's starting in a couple weeks. And then we also have some clinical programs, a virtual parenting group that she's going to be doing in a couple weeks, and then some private services as well. Here are some books that I like. So Coping Cat, that's a practitioner's book, and there's a therapist version and a parent version. It's pretty cool. There's lots of cool exercises you can do with the child. It tends to be pretty popular. What to do when you worry too much. This is a very popular book that you can read to your child with anxiety. This is the book, Breaking Free of Child Anxiety, that is about the space training, which is pretty popular now. And then this is a good workbook for practitioners and school professionals and even parents to help kids who have anxiety. So that is the talk. And I saved a couple minutes at the end for questions. So if you have any questions, now would be your time or your chance to put them in. Okay. So we got a good question here. What about girls and boys and tweens and teens? Are certain groups more prone to anxiety? That's a good question. I would say that, generally speaking, boys tend to have more externalizing behaviors, like aggression and acting out, and girls tend to have more internalizing behaviors, and internalizing being anxiety. So they're gonna, turn inward and sort of take it out on themselves inside, right? Versus boys like taking it out on the environment and externalizing it. And then certainly developmentally, as kids progress into tweens and teenagerhood, all of the social pressures and having access to your phone, and all of the comparison to what you see and Instagram and all that is certainly going to boost anxiety. So I think that it's not unreasonable to think about like a teenage girl or a tween girl to have probably the most anxiety out of any of these populations all put together, especially if the parent also has anxiety. But again, it's also pretty developmentally normal to have anxiety as you become a teenager and a tween, because of all the social pressures. So again, you're looking for interference, like how are these things how are these things interfering on a regular basis, not necessarily are they having anxiety, yes or no. Yeah, we can put the books into the links too if you want. Sam, you can grab those from Amazon. So this is a good question. Are there any ways I can tell whether my child is acting out in a large peer group setting because of anxiety and not because he has a broader behavioral problem? That's a good question. So a lot of times kids won't tell us what's going on, right? And so you have to play detective. So what I would be asking about if someone came in would be, are there any group settings where the child is not acting out? Are there group settings, like smaller group versus larger group? What about if there's like 2 or 3 kids versus 5 kids versus 20 kids? Is it different at school versus like an extracurricular, right? So you're trying to figure out, like, is it about being in a group? Is it about the type of kids in the group? And then seeing, depending on how old the child is, asking them questions about it, trying to get at their thoughts, because usually they're going to be having some kind of negative thought that is driving the ship. And if you can tackle that, you'll be on the right path. Good question, though. How effective is CBT for anxiety with a 4-year-old? So I would say it's not what I would start with a 4-year-old. I mean, you can do things with a 4-year-old, you can make it fun and you can interact with them, but are they going to make any changes without parent training, right? So there's no downside really to it if it's fun and the child has the time and the parents don't mind paying. There's no downside to it. It's not really, I think, the best use of a 4-year-old's time. However, if they're highly verbal, they enjoy it, they like learning, every kid is different, but you're gonna have to have a parent component to it at 4 years old. So I think it's sort of a parent's decision at that point, but clinically it's not where I would start with a 4-year-old. Do you have suggestions for a preteen or child clients who do not want their parents involved with treatment or psychoed due to being a very private person and having strained relationship with their parents? Wow, this is a great question. This seems very important when you work with youth who are seeing anxious traits modeled by their parents but do not want them involved. That's a really good question. I think I would err on giving the child privacy and letting them have ownership over their therapy, especially if the child is very connected to their therapist. That's a hard thing for some parents, to see their child be connected with another adult and sharing things with another adult. But if the parents trust the psychologist or the therapist, then a child taking ownership over their treatment is really a good thing. And you want to foster that and you want to support it. And hopefully you're seeing gains, right? And the child is, getting help with their anxiety and the interference is going down. But I don't think, as parents, I don't really think you have much of a choice but to back off and respect the child's, as long as there's no safety issues and you feel like the connection with the therapist is strong, I think you have to respect it, at least as a trial, see how it goes. Some of these I'm just sidestepping because they're just too big and I need a lot more background information. So this is a good question about COVID too. For more chronic stressors such as COVID, how can we help them cope with what's in their control versus what's not in their control? So that's a good question. I would say that with COVID, and there's a lot of, people talking and giving it, help about this, is you're doing all of the safety behaviors like wearing a mask and getting vaccinated and, staying out of large groups and trying to stay outdoors as much as possible. But you can still get sick, right? So there still is that possibility that they'll get sick. I think that the probability is very low. So you can talk to them about possibility versus probability. You can also talk to them about which things they can make choices, like the parts that they do have control over. And then, trying to have, things that they can still look forward to so they feel like their whole life is not out of control from COVID, right? So kids are pretty stressed. They want to be socializing. They want to be with their friends. They want to be indoors doing all the same things. And, I think that if you can try to find some middle ground for them where they can feel like they're doing something, they're getting a little bit of it. Now, some teenagers just adamantly refuse to accept the fact that it's happening and they can't do what they want to do. And I've worked with families like that, and it's very hard. And there's not a lot you can do. You can't really talk them out of it or explain to them. It's not very rational. But for other kids, you can try to find a middle ground and help them build mastery over their daily lives by doing, the things that are within their control. Good question. So how young are you seeing psychiatrists putting kids on SSRIs these days? I imagine many parents would be resistant to meds and want to start psychotherapy, parent therapy first, right? Yeah, absolutely. And exercise. Yeah, definitely. And I know a lot of psychiatrists that just don't even see kids that young because they just don't feel like medicine is really an option now. And it's very rare you'll have a kid that's super out of control, or the interference is so high that therapy is not going to do anything and they're really at risk. I mean, that's very, very rare. So I just don't see it. You just don't see kids being put on. I mean, most parents are pretty aware of all the options to them now that, behavioral therapy and parent management training is more, in the public domain. But I would be very, very hesitant to starting a child, a young child on medicine without doing these other things first. And then exercise, absolutely. Like an active kid is a happy kid for the most part. So how do you differentiate between anxiety and ADHD? So this is a tricky one because they can look the same, meaning an anxious kid can look impulsive. But the question is, if the child is not anxious, are they impulsive? And the flip side is the ADHD kid anxious? So the only way to know is to ask them questions about it and to do a proper intake. But if you reduce the anxiety, do you still see the impulsiveness? And are you seeing the impulsiveness without the child having any worries? That's how you really differentiate. Now, you can have both. You can absolutely have both. And sometimes I've seen kids, ADHD kids, or I've seen anxious kids who are also ADHD. You give them a stimulant, and it addresses both of the issues, like a Ritalin or an Adderall. And these are kids that are severely impaired, so they need medicine, and it actually addresses both the anxiety and the ADHD. So you need to do a really good differential intake, but those are the types of questions I would look out for. God, there's so many good questions. So this is a question about, have you seen an uptick in anxiety since the advent of smartphones and screen time? And do you think the content that kids are seeing on their phone create anxiety? I'd have to check the stats on it, but my guess is that yes, there has been an increase in anxiety since smartphones. I don't know if it's causal or correlational, but what I think is that what phones are very good at, and what all these social media apps are very good at, is creating anxiety that I'm missing out, like FOMO, right? You have these alerts and you have these stories and all these things that are happening that you have to be involved in or you're missing out. And I think that can create a lot of anxiety, or that people have things or look happy and that you don't. And so that creates anxiety. I'm a huge proponent of limiting screen time, especially for young kids. They just have plenty of time. In my opinion, they have plenty of time to be on screens, and also really supervising them on screens. I think that there's a lot of risks for young kids being on screens too early, just being exposed to things that they're not developmentally ready for. But I definitely think it can create anxiety. So for example, a child sees something on a screen that they're too young for, that will create anxiety, right? They see something that's scary and they don't know what's real or what's not because they're too young. So I think there's lots of, potential risks there for kids and screens. Some of these are great questions, and I just don't have time to dig in. So can you suggest ways to support a child who is anxious about real things, like a sick parent possibly dying, impending divorce or parent separation, COVID, climate? Yeah, that's a good question. So I think it's related similar to the COVID question about, what are the things that are within their control and what they're not, and what are the things that they can look forward to or like plan on. So let's say you have a sick parent, right? So if you don't really know how long the parent is going to be alive, what are your options to do with the child? So depending on the child's age level, you're going to give them information or withhold information that is, developmentally appropriate. So you have to be thinking about that. You also have to be thinking about, like, how do you keep the child's schedule as regular as possible, so that there is predictability. So kids tend to thrive when there's routine, predictability, clear expectations, clear follow through. So even though these things might be happening, you want to try to create that stable anchor for the child, especially an anxious child. And things like divorce and parent separation, these are big changes that are going to happen, but there's still going to be some things that are not changing. And so you want to communicate that and just try to create, if all these things are changing around them, try to create something for the child in their life that is stable. And what can they do if they do get anxious? Like, who can they talk to? Is there anything they're not allowed to ask about? I would have those upfront conversations with the child, and using developmentally appropriate language as well. Oh, that was nice. Someone who said they came to all 3 webinars, and they came to my summer treatment camp, Big Apple Day program, and you attended the parent training sessions and been applying the methods since. Good job. So I'm glad you came back to make sure you're doing it correct. Oh, this is a good one. How do you have a conversation about anxiety with an 8-year-old related to their behavior when they shut down or do not want to talk? Do you describe, then label the issue? Absolutely. So this is a great one. And in general, like, how do you work with someone who doesn't want to work on it, right? It could be an adult, a parent, it could be a child. So the first thing is, you don't want to overwhelm them or force them into having a conversation. Maybe they'll listen, but they won't talk. Maybe they'll listen for 1 minute, but they won't listen for 5 minutes. I think that for an 8-year-old child, they can have a really intelligent conversation about it. They should be pretty aware of their anxiety and being able to label it. But what you're looking for is what's in it for them. That's how I try to, negotiate all these sticky situations. What's in it for the 8-year-old to be able to talk about the anxiety and reduce the anxiety? So how is the anxiety impacting the 8-year-old? And really, you want it to be more of their problem than your problem. So, if you're working with a family and that you're more worried about the issue than they are, that's an issue. And so with an 8-year-old, if they refuse to talk about it, you want to figure out a way of, one, sort of validating and normalizing. Like, I know, this is something that happens with a lot of boys your age. I can understand how it might be really, make you feel really bad. So you're normalizing and validating. You don't have to talk, but I just want you to hear what I have to say. This is what I see happening. And then see how they handle that. And maybe they take it, that's enough, I don't want to talk anymore. And then you come back. The good thing about therapy and working with kids is you always have another chance to take another pass at it. So never feel as a parent that you have to get it right that first time. This is your only shot, right? That does not work that way. And that's a lot of pressure for parents. And I will say that 9 times out of 10, parents are doing the best they can. And these issues are really, really stressful issues, especially now with everything going on in the world. So, these are things that you always have a second shot at it, especially if you're a parent who, is willing to take responsibility for their behavior and apologize. I think I did that wrong. Let me try this again. I really care about you and want to make you feel better. But I think it's tricky, and you have to ultimately think about what's in it for them as you approach talking about this. I see that we are out of time. I'm really sorry I can't get to all these questions. I will definitely take a look at them later. I want to thank everyone again for coming out. And, there's a lot of great options out there for kids and families. And I hope that you learned something by coming today, or maybe the other 2 webinars. And if there's anything else we can do to help, please do reach out. And I hope everyone is healthy and stays safe. And we'll see you very soon. Bye-bye. Oh, and keep an eye out for the email coming tomorrow with the survey and the links to the videos.